Today we're going to talk about lip injections and how they are used to restore volume, shape, and definition to your lips. As we age, we lose volume. It's common. Don't worry about it. It's normal. It happens to everyone. But these lip injections are a wonderful way to restore that volume and provide a more youthful and aesthetic facial appeal to your face. Now, before we talk about the fillers that would be appropriate for you to get lip injections, I think it's important for me to emphasize the basic anatomy of our lips so that you just feel a little more educated when you go to a cosmetic doctor to get these injections. So let's discuss. These are my lips, and I look in the mirror every day, and I'm sure all of you do the same. And one of the things you're going to see is that there's a slight asymmetry to my lips, and that's typical. Everyone has asymmetries in their face. Now that you understand that we all have asymmetries to our face, let me point out some of the basic anatomical structures that we have. Our upper lip is called the upper vermilion. Lower lip is the lower vermilion. We have the vermilion border, which is the border between the red part of our lips and the white part of our lips. We have the Cupid's bow, which I'm sure you've heard of, right over here. Okay, the philtrum and the philtrum columns. Now, these are all areas that we inject filler into, and so just having an understanding of that structure is important. Now, I'm sure you've gone on Instagram and you've seen pictures of Kylie Jenner's lips or other well-known celebrities with huge lips. Now, is bigger lips, sexier lips? I don't know about that. I think we're really moving towards movement where we want more balanced lips that fit our structure of our face. And really the important thing to understand is that everyone's face is different. You don't necessarily want to have the same lips as your friend or of that celebrity. You want lips that fit your face. If you have lips that are too big and you have a small nose or a big nose, it might not be appropriate. And so when you come to our practice, we look at your eyes, we look at your nose, we look at your chin, we look at your profile, and we really want to see, what structure of your lips, what balance of your lips would be appropriate. And so that's something I really want to emphasize to you when you go in for these injections. Don't try to go for bigger lips. You want to go for more balanced lips. You want to try to fix some of those asymmetries that you might have when you smile. Or when you pluck your lips. When you go in for lip injections, don't go in with unrealistic expectations. You want to try to balance some of those asymmetries, but don't expect that they're going to be perfectly fixed when you leave that office. Now, if you're a Caucasian patient, you want to have a 1 to 1.6 ratio of your lips. That means you want your top lip to be slightly thinner than your bottom lip. You want your bottom lip to be thicker. If you're someone of color, it might be a 1 to 1 ratio. That is why I have emphasized over and over again that we really have to consider your cultural background, your facial structure, when we try to figure out the appropriate amount of filler to put into your lips so that we achieve a balance that is appropriate for you. And one of the first things that are done before your lips are injected is a anesthetic numbing cream is applied to your lips so that when you do get your lips injected, you should have minimal pain. In our practice, we use something called a cannula. So it actually has a blunt tip, and we like that versus using a needle because we make less injections into the lips. We're also able to get to certain areas of the lips more easily. And by the way, needles are used very commonly in many practices to inject the lips. But with a cannula, we feel that the bruising and swelling is much less and the recovery time happens to be faster than if you inject with a needle. Now, I should emphasize that you should expect swelling and bruising for at least 2 days and up to 2 weeks after you get your lips injected. So just be aware of that when you do go for these procedures. When you do get your lips injected, we focus the filler on the middle parts of the lips. If we put them out here too heavily, your lip will actually drop. So that's something that you should be aware of when your cosmetic injector injects your lips. Now, typically the fillers come in 1 milliliter syringes, which is a lot of filler for your lips. And remember, the goal is not to make your lips bigger. It's to create balance and promotion of your lips. And so in many cases, at least in my practice, we want to try to use the minimal amount of filler in those lips to create that balance. And then we'll use the remaining part of that syringe to fill in other areas of your face where you might have volume loss. And so that's just something to consider, that when you do go for these lip fillers or lip injections, that you don't have to feel that that entire syringe has to be used on your lips, because you might achieve a goal that you don't want. You don't want monkey lips. You don't want big lips. You want balanced, beautiful lips that fit symmetrically with the rest of your face. So let's talk about some of the popular fillers that exist and the fillers I want you to avoid at all costs. Now, typically fillers last anywhere from 4 to 12 months, and the cost can range from $500 all the way to $2,000. That's really based upon who is injecting you. Now, these are the big no-nos when it comes to getting lip fillers: silicone, Bellafill, Artefill. No. These fillers are not reversible and they're not FDA approved. The other filler that I don't think is appropriate for most patients is the original Juvederm, or Juvederm 3 and 4, Juvederm XC. The reason for that is because it's very hydrophilic. It attracts 6 times its weight. So when you inject it, in some cases you can get a monkey look to your face, which is something we don't want to achieve. The other issue with Juvederm is it's migratory and it can travel beyond the vermilion border, into other areas of the dermis. However, in some cases, it's appropriate if you have very, very, very thin lips and we need to plump them up, or you have something called scleroderma. Now, the filler that's going to be appropriate for your lips is a hyaluronic acid filler, which is made up of a polysaccharide that naturally occurs in your body. It creates hydration of your lips and elasticity, movement, easy movement of your lips. And those are all wonderful things. And the other thing about hyaluronic acid fillers that I love is that they are reversible. Yes, you heard me, they are reversible. That means if you don't like the results, you can go backwards. You can remove the filler completely. Or if you have a lump where there's a asymmetry that you don't like, that could be fixed and removed as well. And that's removed with an enzyme called hyaluronidase. Now, the fillers that I do think are appropriate include Restylane, Restylane Silk, Restylane Refine, Restylane Define, Restylane Kiss, Juvederm Volbella, Juvederm Volure. In our practice, we like to use Restylane, and we really like Restylane because we think we get the best balance, contour, and natural look for our patients. But I really want to emphasize one last thing. At the end of the day, when you get these hyaluronic fillers, what matters more is not the filler. What matters more is who's injecting your lips. You want to go to someone who has a lot of experience. Cosmetic doctor, dermatologist, or plastic surgeon who has done this procedure hundreds of times, who knows where to make injection sites in your lips to decrease bruising and swelling. At the end of the day, there's no perfect injector. No perfect injector. So it doesn't matter, even if you go to someone experienced, you might get complications, but to limit complications and to get beautiful results, you are paying for experience. So don't just buy the $500 Groupon deal to fill your lips. Pay extra for experience. I hope you found my explanation of lip injections informative. I love to hear your experience if you've had lip injections before. And if you have any questions for me, leave them in the comments below. I'll make sure to answer them, and I look forward to seeing you in my next video.